Hey, everybody. Welcome back to the Beat Podcast here in Los Angeles at the live Vive event. Today, I have the privilege of hosting Zane Burke, Chief Executive Officer and board member at Quantum Health. He has an extensive results-oriented experience guiding healthcare technology companies with innovative and disruptive business models, an IT leader, and I'm excited to have him here on the podcast. Zane, welcome.
Great to be here, Saul.
It's a pleasure to have you. Look, you guys, maybe just to kick things off here, a big news that you guys just released with Vanderbilt and the affiliated network. Do you want to comment on that?
I appreciate it. First, let me do a little on Quantum Health. Quantum Health represents healthcare navigation for over 500 clients, 3.1 million members. We create the connective tissue between a clicks and mortar world. And so the announcement today is pretty consistent with what we're trying to accomplish overall from a mission perspective, which is to really put together a high quality network like Vanderbilt is, and along with a navigation solution and really drive different kinds of outcomes for self-insured employers. And if you think about the long-term elements of this, value-based care was going to revolutionize healthcare, narrow networks were going to be in there. The problem has been really how to activate those networks at the end of the day. And what navigation does is allows us in the life flow of the member to appropriately steer towards those types of programs. This gives health equality to all people in Tennessee, the opportunity from that perspective, because when you give them access to a high quality network like the Vanderbilt Health Association and associated networks, along with the best in class navigation service, we can actually raise the equity for everybody. Whether you're the CEO of a company or whether you're the frontline factory worker, you're going to get a high level of care quality. And so the marriage of those two pieces really will bring appropriate steerage, will bring the right kind of volume to value-based care, and really get what self-insured employers are looking for, which is really value, and making sure that the money that they're investing each and every year in healthcare benefits is getting to those members and having a great experience. So we're super excited about that. And it's a first of its kind in the industry.
Congratulations on that. And congratulations to the employers and community members that will benefit from this relationship. How do you see digital transformation reshaping healthcare delivery in 2024? And what are the main challenges and opportunities this presents?
There's been a ton of innovation in digital health, which on the one hand has been fantastic. On the other hand, people haven't gotten a benefit from that many of those digital health solutions because unfortunately, that technology hasn't been in the life flow of a member. If you're an employer or a health plan who's invested in one of those digital health solutions, you may have this great tool, but if it doesn't get to the member when they need it, and they only need it when they have an adverse event somewhere. And if you're like me, Saul, I don't know exactly what's in my health benefit plan. And so whether it's an MSK solution or a diabetes solution, I hope that as a member, I hope I never need those.
Right.
But what does really work great is if right now I've got a trick knee, and it's really important to have the right kind of steerage at the moment that I need that steerage. So employers are looking for, and health plans are looking for, how to activate and engage in this time. How do I get the value out of those solutions? Because there's just so much fatigue from the HR side, particularly on the self-insured benefit plans and those employers. They don't know which ones are effective, which ones have the right kind of outcomes. We actually do. So one of the best parts is we can provide both a better experience and provide the engagement in the life flow of the member, which is a huge challenge for employers. The other part of this is rising costs. So the cost side of this, healthcare has got pent-up inflation. You've seen the data. I can tell you that's very real. And what's also tricky is because it's pent up, the way that the contracting works, inflation is baked in almost for the next 18 months. So you can guarantee that there's going to be an increase in healthcare inflation over the next 18 months because of how the contracting works. So it's a fatigue on digital health side. It's how do I get costs under control? And then how do I ensure the best kind of experiences for my members at the end of the day? And so increasingly what we're seeing from health plans and from self-insured employers is they're looking for ways to get better experiences. At the same time, how do I drive cost out of the model in total? What has historically also been a traditional HR only conversation increasingly is coming to be more of a CFO driven dialogue as well. So lots of dynamics at play in 2024 from a digital health perspective and from what our buyers are looking for as they move forward.
Yeah, thank you for that, Zane. In a nutshell, it's making these digital transformation, these moves that are being made available.
It's totally right. And again, none of us actually want to be consumers of a healthcare. We do healthcare to do other things in our life.
Exactly.
For me, I like music, whether it's a cup of good coffee, the experiential side of life. That's why I do healthcare, so that I can get to the other things that I really want to do, spend time with my family, friends. It's not healthcare for healthcare's sake. And so the key to all of this is, how do you deliver that benefit, that value, that healthcare experience at the time that the member needs it, such that they can get back to the things they really want to be doing, which is not to be a consumer of healthcare at the end of the day.
Amen to that. I totally agree with you there, Zane. Quantum Health supports employers and how they offer their health benefits to employees. What are some of the major concerns of employers today, and where do you see navigation addressing these?
And we touched a little bit on that,
a few, yeah.
The digital health side of that and the cost side. When you look at the experiential side, I think that's a part that's underplayed. The insurance companies, frankly, have just failed as it relates to creating an experience that any of us would say is a positive one. And it's not that they're bad humans. They were just designed to create transaction flow. Mm-hmm. So how do I quickly move through this transaction? And as opposed to really looking for how do I solve the problem of better experiences, which means that my members are more likely to engage in their own healthcare when it matters to them. Mm-hmm. How do I drive to better clinical outcomes, which is also going to get to a better financial outcome at the end of the day? Those employers are looking for those better experiences. And in my world at Quantum Health, which is a particularly unique element because that provider engagement and that provider experience piece gets the data back from those people that today is lost in healthcare. And so much of what people are trying to do out there, they want to either avoid one of those legs of the stool. That's what's super unique about what we're doing, is actually bringing those together, the member, the provider, and the client, or whoever's paying the bill at the end of the day, and saying, how do we get the best data in the life flow to the member so they can get the best outcomes? That solves a bunch of the problems that our employers and plans are looking for, which is, I spend a lot of money, what's the experience, and what is the ROI on this? And those are the two big drivers for what our clients are trying to solve.
Love that. And you keep going back to the life flow, right? And it gets out of the transaction, gets into the life flow. You want to unpack that a little bit? Or?
It's super simple. I mentioned that none of us want to be consumers of healthcare, but we know when you're going to enter the health system. So in our world, you can't enter healthcare without coming through Quantum Health, nor can a provider actually get paid for their care without coming through Quantum Health. That creates a health signal. And so that cues up a workflow in our world. And I will often talk about one that we can relate to because it's a tough health signal. But if my physician sent a pre-authorization request to say, is Zane Burke eligible for a PET scan, means a suspicion of a cancer, that health signal hits the cutting room floor in all of healthcare today, period, except for at Quantum Health. In our world, we're going to take that as a health signal, cue that up, and say, wow, there's a suspicion of cancer. Next time Zane engages with us, or we proactively reach out because we don't want to be the first person to say, physician suspects you might have a cancer journey. That's not our dialogue, but we want to be aware of that. In that real time, and we call that real-time intercept. So we use those health signals to drive real-time intercept. What happens from a practical purpose is before a member has spent $1,000 on their way to spending more than $10,000, we've engaged with them over 90% of the time because we use those health signals. And that just drives a different kind of engagement in the life flow. And oftentimes people are reaching out to us to say, what's in my benefit plan? What's my deductible? What's my copay? People don't reach out to their insurance company to say, what's my deductible or my copay for kicks. Yeah. They're doing it because they have an ache, a pain, or result, concern. Mm-hmm. Those are health signals. We're going to capture those. We're going to answer first the questions, whether that's digitally, or whether that's a human touch at the end of the day. And that we build trust up front as part of that process. When a claimant is spending more than $10,000, we've engaged over 18 times on average with that person. That creates a different kind of rapport, different kind of trust,
Totally.
and gets it back into the life flow. And we'll take on hard pieces that a lot of healthcare drops and puts the patient or the person in the middle of the healthcare process. And we're the least equipped to handle it because we don't do it every single day. And so what we do is take on those hard pieces and say, how do we help you schedule that appointment? How do we help you with that outstanding deductible? Hey, maybe we'll reach into the community and get the pieces, get the Boy Scouts to build a ramp for you. We do that kind of work. And
that's awesome.
And that's what I mean by the life flow.
Yeah, that's great.
It's like literally creating a different kind of experience at the end of the day. We use a term at Quantum Health called healthcare warriors, which you might chuckle a little bit on the front side and say, healthcare warrior, what does that mean? For us, it is working on behalf of our members to get them the full use and best use of their benefits. And so you say, oh my gosh, you're going to get the full use of the benefits. How do you save money if you're trying to drive towards full use of benefits? Turns out doing the right thing actually saves money. Because what we're doing is getting the right second opinion. What we're doing is keeping people in network. What we're doing is reducing their out-of-pocket costs because we keep them in network, because we can get them to the right places at the right time for the right care. And so that just creates a different kind of a experience from a life flow perspective. And I'm 100% convinced that it has to be at the moment that the member wants the experience, not the moment that the carrier or the company wants to call you. Because if somebody calls you at 6 o'clock at night and says, your A1C was high, and if you don't take care of your blood sugar, you could go blind or lose a limb. Okay, you know what? I'm just trying to put food on the table for my kids right now. I really don't have time for that experience. But if it's in the life flow of the member that they're checking on their deductible, they're checking on what's available in their health plan, et cetera, that's the time you can give appropriate nudges, appropriate coaching, and really move the meter. And that's why, and we use what we call our artificial intelligence real-time intercept solution around to go drive that engagement early and often. And so much so that when you think about people talk about claims, we do the first health signal typically comes 4 to 6 months before the first claim comes in.
4 to 6 months?
4 to 6
Wow.
months.
That's
way ahead. So that's how the mousetrap is different.
Yeah.
And it's different because of the life flow piece. And we talk about that a lot, obviously, internally, is how do we make more of these things where it's about what the member want? Mm-hmm. How do they think about this? And making the journey as simple as possible for them so they can get back to the things they want to do.
That's fantastic. No, I really appreciate the insight there, Zane. But you mentioned AI. So on the topic of AI and ML, buzzwords in healthcare.
Absolutely.
In what ways do you see these technologies making a tangible impact on both providers and patients?
I've mentioned how we use it today for around our health signals and our real-time intercept. But as it relates to the future, it's really about, again, make the experience better for the member. How do we shorten that amount of time that you might either be using the electronic pieces of what we do or the member-facing pieces of how we work on that? And what I mean by that is, how do we use natural language processing, machine learning, artificial intelligence to create better experiential elements such that you don't spend time having to revalidate who you are each and every time, mm-hmm. that you're not having to go through a series of questions that you've done 10 times over, which happens in healthcare all the time. Mm-hmm. And so we're doing that today. Where we see this going in the future is more around we know that pre-authorizations, for example, it's a major pain point for both providers and members because they get caught in the crosshairs of have my procedure been authorized, and the turnaround times are ridiculous for most insurance companies. And in my world, that's 48 hours SLA typically from my perspective because it should be very quick. But we want to really get to where when it's 99.9% of these pass through, use the artificial intelligence and pass them through. Let's not spend any time on things that are going to pass anyway. And so how to use the artificial intelligence to improve that experience is like use the logic behind the scenes to have where we're not, as long as we can capture the meaningful health signals along the way for the other that fire up all the rest of the machines here, let's pass that through. Let's make life easier for members, make life easier for providers, so we can focus in on the things that really are going to matter from a cost and quality perspective, both for the client and for our members.
Love that. Great takeaway there. And really, last one here for you, Zane. How's your organization working to ensure that advancements in healthcare technology are accessible and equitable, particularly for underserved or rural communities?
Health equity should not be a political element. Health equity really, to me, just means how do we get the best care all the time for everyone? And you look at the example of the Vanderbilt Health Network and what we're accomplishing there, where we'll raise the standard for every Tennessean that's on a Quantum Health and Vanderbilt Health Network program to a high quality. And I can't tell you how many times I've been in healthcare for 30 years. I'm getting old, unfortunately. But people continue to call me and say, hey, Zane, where would you go for this cancer, or where would you go for this treatment, et cetera? And I'm fortunate to have connections, and I've been around a long time, and I've got my checkbook's bigger and all those kinds of good things. What navigation does is raises everybody's skill set way past mine, because I don't know who's the best provider in that community every time for that particular procedure. I don't know what the full value of the benefits are in your plan. Quantum Health knows that. What's great about navigation, and particularly the brand of navigation that we're providing at Quantum Health, is it raises the health equity for everyone to the highest level possible. And it's not a sum of the haves and have-nots. Everybody can do it, because this is really in the information that's out there. How do we democratize that information? And again, deliver it in the life flow of the member when they need it. And it's going to have the most efficacious outcome for them. And guess what? That creates the best experiences too.
Love that. Yeah, love that. That is a fantastic way of bringing Tequity to everybody that's on the platform. So really big kudos to you and the team for the amazing work that you're doing. For all the listeners, if there's a place that they can go visit and check out the work you guys are doing, where can they go check you guys out?
They can go to quantumhealth.com. They can check us out both on LinkedIn and Twitter, and either at Zane Burke at LinkedIn or at zaneburketwitter.com. So those are still available out there. I guess I should say X now.
X now, yeah. Yeah, and folks, we'll leave all the ways to get in touch with Mr. Zane Burke here in the show notes. So make sure you check out the show notes, the summaries there, calls to action, links to all the resources that Zane shared. Zane, thanks so much for being with us today.
So really appreciate the time and interest in what we're doing.